Henry, thank you. It's been a full week since the first wildfires broke out in Southern California, and emergency rooms continue to report an increase of patients complaining of coughs, chest pains, shortness of breath, and in some cases, skin irritation.
So what's in the air that's causing these symptoms, and what can we do about it? Joining us with the details, Alice Benjamin, an emergency room RN and clinical nurse specialist. Good to see you. Thanks for coming back.
Good morning. Thank you.
So what do we need to know about these wildfires, especially for people who are not directly in the burn areas? It seems obvious if you're in the burn area that maybe you should limit outdoor activities, but what if you're just outside of it?
Right. Well, so what's important to know is that you don't have to be in the thick of it to have exposure to the harmful effects of fire. You know, these chemicals and these gases that are in the air can travel for miles, and some of the gases can even be odorless, so you can't judge the scent of what you're smelling to determine how dangerous it is. So, and with the winds that have been the way they are, it can travel for hundreds of miles.
Wow. So what are the things we're inhaling, and why is it so dangerous?
Oh gosh. So, you know, this isn't your traditional fire, wood burning fire here. So there's brush, there's homes, so there's lots of gases and metals and carbon monoxide, sulfur, nitric oxide. The list goes on of what's actually burning in these fires. So these dangerous gases get into the air, and there's also these fine ashes and particles that are not visible to the naked eye. So they're traveling for miles, and as we're breathing, we're outside and breathing, doing normal activities, we can inhale these things, and even more so if you're engaging in rigorous activities, you're working out and playing. So we really want to try to avoid some of those things out there because we don't want you inhaling these dangerous particles and gases.
But you have to breathe and you have to go outside. Are they long-term effects, or are they things that just, you know, for the moment might affect you?
Well, for the moment they might affect you. For the average person, so we do have to breathe. So when you're outside, you want to take some precautions, trying not to breathe these gases and particles in. And again, you don't even know that you're breathing them. That's the dangerous part of it. But so there are some symptoms that will lead you to know that you may be exposed to them. So when these particles and these gases, when you inhale them, they can cause irritation, right? So itchy nose, runny nose, coughing, watery eyes, some chest tightness, and some short of breath. So when you're outside, you want to try to limit your outdoor activity so you're not exposed to some of these things.
It's interesting because some of those symptoms you could think is also a cold this time of year, right?
Yeah, so a lot of people think that they're just allergies.
Yeah.
But then you have to consider, you know what's going on. So if you know that you're anywhere in the vicinity of a fire or a fire is going on, you want to limit your activity going outside, and there's some other precautions.
Yeah.
So for example, you want to wear a properly fitted mask. Now I've seen a lot of people wearing masks, and if you don't have anything, obviously a scarf, a rag, anything, but there are very particular masks, N95 masks, that are licensed to prevent those small particles coming in. Anything less than that will not protect you from those things, and they also have to be fitted properly. So I've seen, young children wearing large masks. You know, it's a for effort, but it really may not do the complete job that we want it to do.
There's also the idea of pre-existing conditions, people with asthma. What folks they really need to be mindful of our air quality?
So anyone with pre-existing lung diseases, so if you have asthma, COPD, or if you're someone with cardiac disease, are very young and are very old, senior people, and those with developing lungs, and pregnant women. Those are high-risk people when exposed to these things, can actually experience more extreme symptoms and sooner than those, without those pre-existing conditions.
I went for a bike ride this weekend, and I went on a website to see what the air quality was in the air. I think it was called Air Now. Is that the best one, or are there others? Or?
Well, I like airnow.gov, and what I want to encourage people to do is just like we go to our apps to check, is it raining? It's not raining in California right now, but we need some rain. But going to check the weather, you can actually go and check the air quality. And especially considering the fires that are happening now, I think it's very important that people go to that website, check that out, and maybe use that as a way to gauge your activity. Again, wanting to avoid strenuous activity, making sure that you're limiting exposure to unnecessary smoke. If you have an air filter in the house, run your AC. That can help filter out some things, but definitely want to take some precautions to protect yourself because you can't always see or smell these things in the air, and they're causing some very harmful effects.
All right, good information. And for more about clinical nurse specialist Alice Benjamin, follow her on social media, and you can check out her website, asknursealice.com. Thanks so much for being here.
All right, still ahead.